Good evening, everyone, and thank you for joining tonight's webinar. I am Dr. Damia Harris Madden, and we are so excited to bring to you our Children's Environmental Health discussion. Our County Executive, George Latimer, proclaimed October 13th as Children's Environmental Health Day in Westchester County. This, however, is a statewide observance, and we recognize the role that all citizens of Westchester County and New York State play in protecting our children and youth as well as the environment. We are extremely thrilled and excited to have distinguished panelists and dynamic young people who will have a conversation around the promotion of physical, mental, environmental health, and general wellness. So before we begin, please allow me to introduce our county executive, Mr. George Latimer.
Hi, I'm Westchester County Executive George Latimer. Westchester has proclaimed October 13th, 2022, as Children's Environmental Health Day as part of a statewide observance, which lasts through the month of October. In observance of Children's Environmental Health Day, the Westchester County Youth Bureau is hosting this webinar. The webinar is led by youth from the Youth Bureau's Youth Empowerment Council for Change to address children's and youth's physical, mental, and environmental health and well-being. This webinar discussion is a way for members of YECC, comprised of various young people from across Westchester County, to share their perceptions on their health priorities for children and youth. Along with Deputy County Executive Ken Jenkins, we have met with this talented group of young people on issues such as physical and mental health, and climate change and environmental conditions that affect the community. This webinar is a collaboration between the WCYB and doctors from Columbia University. It is the first of what we hope will be a long and continued partnership. Parents and youth service providers benefit from hearing directly from medical experts on ways in which they can promote physical, mental, and social health during the year round, and particularly during the school year. Thanks for being a part of this important webinar.
Thank you, George, for those remarks. As George often says, a great county is only as great as those organizations and individuals that set an exceptional example, whether through participation in volunteer programs like this, through unique achievements, or simply through a lifetime of good citizenry. And so I am thrilled that Columbia doctors have dedicated their time, talent, and expertise to partner with us. I am equally thrilled to have a representative of the United Nations Association. But most importantly, I am very proud of the members of the Westchester County Youth Empowerment Council for Change. The YECC is an organization that began under this administration 5 years ago, and it has grown tremendously. We have some dynamic young people who have really great questions and have made sure to involve themselves within their local communities and the broader community. So, without further ado, I'm going to turn it over to one of our MCs tonight, Arun.
Greetings, everyone. My name is Arun Nayakar, and I'm a member of the Youth Bureau's Youth Empowerment Council for Change, and I'm joined by my fellow YACC members. We are fortunate enough to have expert panelists who answer questions about environmental, physical, and mental health. Dr. Vicky Iannotti is the medical director and assistant professor of pediatrics at Columbia Primary Care in Tarrytown. She's over 26 years of experience caring for children, youth, and families. She's been on many committees to ensure quality and safety and has taught medical students and residents.
Hi, I'm Bella, and I'm a member of the county's youth board and of the YACC. Dr. Anthony Poliafico is an associate professor of medical psychology in the Division of Child and Adolescent Psychiatry at Columbia University. He is the director of the Columbia University Clinic for Anxiety and Related Disorders in Westchester, and is an expert in many areas, including anxiety, OCD, and school refusal.
Paul Presentiu is the Young Professionals Chair for the United Nations Association of Westchester. In college, he majored in environmental studies and served as an active member of the SUNY Student Assembly's Sustainability Committee. He's the chair of the City of New Rochelle's Ecology and Natural Resources Advisory Committee and serves on the New Rochelle School District's Green Schools Committee. Dr. Iannotti, can you please tell us about what you do and what trends you are seeing among youth?
Hi. I just want to say thank you for inviting me to be here tonight. I am very happy to be part of this panel and to talk with all of you about your concerns. So I am a pediatrician, so that means I take care of people from birth until the age of about 22. And take care of, meaning in a preventive way, right? As all of you have gone to your pediatrician over the years, giving vaccinations, talking about preventive health and wellness, treating infectious diseases as we get sick, and guiding parents and then adolescents in the decisions that they're making as they grow up. And as far as trends, I think all of us have had a very special and unique time in this last 2.5 years with the COVID pandemic and how that has affected all of us, especially children and adolescents, as you have had a major part of your life surrounding school be turned upside down. And that has led to changes in your day, in your learning environment, in your relation to your peers, in your ability to participate in activities. And so as far as health trends, certainly we have seen childhood obesity increase and feelings of isolation and difficulty. And I think that has been, really brought to light in sort of the recent years of more and more focus on social media and being able to play video games rather than go outside, and sort of really skewed children's view of what's happening outside of their home in their peer groups.
Thank you, Dr. Iannotti. Next, we're going to go to Dr. Poliafico. So could you tell us a little bit about what you do and the trends that you're seeing?
Absolutely. And I'm very pleased to be here and just so excited to see, all of you participating in this forum and really caring about physical health and mental health right now. So I am a clinical psychologist and I work with a team in Tarrytown where we provide a number of services to really help kids, teens, young adults, and their families meet their goals, manage stress, and manage whatever other mental health problems they may be dealing with, whether that's anxiety, depression, related concerns, difficulties with school. We provide a lot of different services. Sometimes that's, an individual therapy service. Sometimes there are groups to provide support. So there are a number of different ways in which we're trying to help kids and teens and families. And we also work a lot with the Westchester community and schools and school districts to really support kids and teens right now to be, keeping a real eye on mental health and prioritizing our mental health as kids are doing school. Regarding trends, I'll piggyback on some of what Dr. Iannotti was saying. We've seen certainly some disruptions due to COVID and some other trends happening right now. We've seen some increases in sadness and loneliness, which isn't surprising as we move through COVID. But I've also seen a lot of resilience in many of our kids and teens and really kind of finding ways to adapt to, in some ways, a changing world with regards to technology, with regards to climate change, which I know is an issue that we may discuss today. And kids and teens still focusing on what they need to do and finding ways to be kind of fulfilled and be happy. And our goal is really just to help every kid and teen get to that place where they're managing stressors but continue to be fulfilled and doing meaningful things in their lives.
Now I'm going to turn it over to my peers for their questions. So Julianne, if you will start.
Hi, I'm Julianne. I'm one of the co-presidents of the YCC, and my first question is, what factors into the environmental health of children?
So I can certainly get us started just from a mental health perspective. You know, when we're talking about environmental health, we're thinking about what are all the different environments that kids and teens are facing. Certainly on a global scale, there's our planetary environment, and we're thinking about climate health, and an area that I'm very interested in, and I think is one that kind of factors into mental health, is dealing with all the issues of climate change and the world that we're taking on, and the stresses of climate change. How does that affect our mental health and our young people's mental health? What are the stresses they're carrying? How do we support them in managing that? And how do we find ways for them to, how do we find ways for all young people to manage those stressors and move forward? But you know, I also think about environmental health a little bit differently. I'm thinking about what are all the other environments, family, school, and what have you, and how do we make those, you know, those circles around a child or teen as supportive and helpful as possible.
Thanks for that answer. Our next question is, now that we are back in school and going places, how can we minimize our risk of getting COVID-19?
I can take this question. So I think one of the important things we can do, many of you may have already taken that step, and that is to get vaccinated. We have good vaccines for all ages, you know, from as young as 6 months old, and the vaccines are safe and they are effective. They don't prevent us from getting sick, but they certainly help us to build antibodies and have some immune response, you know, if we are exposed and we do get sick. We don't get sick as badly. So that's a really important step. The other thing that has been shown for decades to be one of the most effective things to prevent spread of infection, as we have known in hospitals, is hand washing. Such a simple thing, right? And probably something that, you know, your parents have always told you to wash your hands before you eat, right? So the passage of germs. But with the COVID pandemic, I think that people really got to understand, you know, how long do you wash your hands, and how, you know, how effective soap and water is, and carrying hand disinfectant with you. So that's really key, and really have to remember that protects us. I think other things that are important is, you know, what else do we do to keep our immune system functioning at its best? And that is making sure that we get enough sleep. And adolescents, you know, really don't sleep enough. You know, I know you guys have busy schedules and lots of homework pressures and things, but it's really key for you to sleep. It helps your body function properly, helps your mind function, and you actually learn in a shorter amount of time when your mind is rested. Good nutrition, right? Again, just helping our bodies to do their job efficiently and effectively by giving ourselves good nutrition. So a balanced diet, including veggies and fruits. And lastly, I would say, you know, when you are going to participate in an event, or, you know, where there's a large gathering of people, I would just say, you know, ahead of time, before jumping, you know, think and consider, like, is this something that's important and I really want to participate? And participating is important to do, but, you know, how important is it, you know, and what are the risks, you know, for me to get sick, whether it's COVID or flu, or, you know, just we've had some bad viruses going around with high fevers and coughs. And so I think just to pause and consider, is it something important that I really need to do? And then, you know, if you go and you participate, whether, you know, it's a concert or large gathering somewhere, you can also think about wearing a mask. The masks help in some way, and it doesn't have to be a mandate. You can wear one for yourself just to maybe prevent some spread of infection.
Thank you. That was really helpful. I want to ask Mr. Prezendu, can you just tell us a little bit about what you do and your role in protecting the environment and quality of life in the county, and what trends you're seeing with youth and the environment?
Thank you so much, Isabella. Well, one, I would say that we're very fortunate to be here in Westchester County, which provides a great environment for people to develop themselves as environmental leaders. It wasn't too long ago, in 2019, that I was approaching our Dr. Demir Harris Madden about the creation of a Youth Climate Action Summit, and we were able to establish that, even though the COVID-19 pandemic did have us postpone that and transition to a virtual program under the leadership of our under then Vice President of the board, Abe Baker Butler. But the work that I'm doing now, whether it's through the United Nations Association, is helping with creating that global dialogue of letting people know that there are resources that are available for them to assume local leadership to address some of these global issues, and really taking that with me with my work in the city of New Rochelle, where I'm working with Mayor Noam Bramson and our city council, put together climate policy and be able to make sure that we're doing the best that we can do to establish climate resilience through the lens of environmental economics. It's really important that we let to the spectrum of things that are happening outside of our control. I read earlier this week about a floodplain that's in Louisiana that's impacting 20% of the population. Louisiana has about 52,000 residents that live there, and it's a floodplain that's impacting 10,000 residents. So instead of us, losing ourselves to the emotional spectrum of what's occurring there, it's important that we empower ourselves with things that we could do locally, making sure that we're getting youth representation on our board, on our environmental advisory committees, and empowering young people to really put together the infrastructure that's needed for intergenerational dialogue. But what I'm witnessing young people do through young, amazing leaders like yourselves, Isabella, is making sure that our school districts are being engaged, making sure that they know about climate policies and how they could be on a pathway towards decarbonization with grants that are available from NYSERDA, and really making sure that Westchester County does serve as that role model for the other 61 counties in New York State and the other regions of the nation, to make sure how we can really come together and put together the dialogues like this so that people could be aware of what they can do.
Thank you. Next, we want to open this up to everyone and ask, how is climate change affecting our physical and mental health?
I'm certainly very interested in what Mr. Prezendu and Dr. Ayanati have to say, because I think this is an issue that climate change is affecting our health and our well-being in so many different ways. I think of a few different ways in which I personally see, and I know in other ways is impacting mental health. I think that the climate disasters that we're seeing more and more of due to man-made climate change is led to trauma and grief for many families, many individuals, and many young people, particularly in more vulnerable or marginalized populations. So, we're seeing folks who are, experiencing grief and trauma due to these disasters. We're also seeing chronic effects of climate change, such as extreme heat or drought, really affecting our well-being and leading to increased depression or aggression and mental health concerns. And then finally, we see a lot of folks, including a lot of young people, who are really carrying a lot of anxiety about what will be the future effects of climate change and what will their futures look like. And, these may be concerns that you all may have. It's certainly concerns that I have, both as an individual, as a parent, as someone who, works with kids and families. And so these are all the different ways that, we're seeing climate change impact mental health. And then I imagine, I'm just assuming, and we're actually planning for, ways to continue to help kids and families moving forward. So we're already thinking about how do we, set up mental health interventions to support and provide care for kids and youth and families.
Yeah, I'll just add in that, today, young people are just exposed to so much new technology, especially YouTube. You could go to YouTube and access resources to prepare for medical school, or you could go to YouTube and stumble upon a video of people that are discussing flooding issues in Pakistan. And it's really important just to access resources. I know our county has a dynamic Department of Community Mental Health, and there also are regional organizations that could help out. I came across the Climate Psychology Alliance of North America that has a listing of clinical social workers that have exposure to climate anxiety and helping with those conversations. So really just making sure that those resources are accessible while people are aware of issues, whether it might be locally or on a regional or national plane level as well. I would add that in terms of what I mentioned about Louisiana, it's 52,000 square miles of Louisiana, not the population. So it's 52,000 square miles of Louisiana, with 10,000 square miles of that being affected by a floodplain. But while you're being aware about all these issues, it's important that you do be able to identify resources that can help you digest that information so that you could be the forward-thinking leaders that you are.
Next, we want to hand it over to Naveen to ask a question.
How can teens cope with the constant flow of stressful news in the world?
I can certainly get us started here because we're certainly impacted by stressful news. It feels like more and more. We're getting news much more easily. News comes to us much more easily, and it feels like there's more stressful news. I think there's a number of things, though, that that young people can do, that we all can do to protect ourselves or to kind of manage that stressful flow. I think one is to really think about what are the ways in which news is coming to us and how do we control that flow. Can we turn off notifications on our phone so we're not looking at our phone and immediately seeing stressful things? Can we set boundaries or limits to when and how we use social media, or what news is coming in through our social media feeds? And otherwise focusing on what we all control and what's going on in the house, what are we exposed to in terms of the news being on. We can control that. And I try to set for myself, and I talk with folks I work with, are we getting news to get information and to be updated? Or are we seeking out news to either try to reduce our anxiety or to kind of like feed into that process? And if it's not to update ourselves, then it may be unhealthy and it may just lead to increased stress.
And I'm thinking, I agree with the great points that Dr. Poliafico just made. I think also because I do see kids in the office, children and adolescents especially, who are absorbing a lot of the stressful information that's there, and they are coming in with complaints of headache, abdominal pain, just feeling fatigued, sort of what we call generic, like nondescript symptoms that they're not feeling well, right? Can't sleep well, all of that. And so once we've established that there isn't something physical going on, I find myself in conversations with adolescents as well, and trying to get them to focus on what they can change and affect in their own lives, and staying focused on their goals and trying to be knowledgeable and involved, but not have it overwhelm them so that they can accomplish their goals, right? So staying positive, finding a balance, communicating with adults, whomever the adults are, could be parents, could be friends of the family, could be the guidance counselor at school. Many kids are talking to a therapist, just really keeping the lines of communication open and realizing that if they are feeling a physical complaint like a headache or fatigue, to understand and accept that it's okay, that it is the stress that is manifesting itself that way. And by recognizing that, sometimes you can take the steps back to being in a better balance again.
I do want to emphasize just making sure that you control what you're exposing yourself to. Again, everyone is so technology exposed. I didn't get my first cell phone until I was in the 10th grade. And that was just to let my parents know if I'm going to be home late, I'll call them. Otherwise, I'll be grounded. I can't play outside during the weekends. And now I'm getting FaceTimes and iMessages from my cousins that are 10, 11 years old. So I know we're definitely in a different technological era. But with that comes a responsibility of knowing what you're exposing yourself to, and also speaking to some of your mentors and making sure that you could lead upon their wisdom on what you might have been exposed to, especially in regards to our climate disaster and other issues that are happening in other communities that may be out of your control. So just make sure you do your due diligence when you're on what you're exposing yourself to, and making sure that you lean upon others that are subject matter experts or could help you with really taking in what you may have been exposed to make sure that you're closing the loop in a positive way as possible. And also, don't be afraid to speak up. Make sure that you're able to talk to professionals, talk to your counselors about anything that you may be dealing with, because these things may bottle up, and it's important that you are able to address those.
Thank you all for sharing. Next up, we have Sarah.
Hi. So it's been mentioned that there are a lot of resources for youth in Westchester County and the surrounding area. What resources are those exactly to help improve physical and mental health for young people?
So I will jump in as the representative for Westchester County. Sarah, we have a plethora of opportunity here in this great county. Let's start with the environmental, mental, and physical health aspects that we know can be addressed by simply taking walks or hikes. We have the most beautiful landscape here in terms of our open and green space. Those kind of activities that I just mentioned can be useful. But in terms of actual resources, obviously, Columbia doctors can speak to the resources that are within their facilities. But we also have a number of resources that are made available on our Westchester Gov website through the Department of Community Mental Health, through the Westchester County Youth Bureau, as well as our Westchester County Department of Health. And so there are a number of for-profit and nonprofit organizations that operate within Westchester County that most certainly have clinicians on hand, as well as, of course, those that are medical experts that can assist with all matters. But I wanted to put a plug in for Westchester County because we know that there is no shortage of resources. However, access is really what can be challenging, particularly for young people. And this is why we do these types of forums. And we are so thankful for the partnerships with Columbia Doctors and others, because we then can, kind of pool our resources together, make them available. We do have a library on our website that is can be accessed by anyone who goes to the Youth Bureau site. And if that's not enough, we can also talk about ways to enhance the resources that we have, at least the access to resources that we have. And so I'll now turn it over to the medical doctors who can speak to some of the resources, and then Paul, that they are aware of. Dr. Arianati?
Sorry. I was thinking that Dr. Polifico would take this one. He's an amazing center just around the corner from my office, and I think that is a huge resource. Center for Anxiety and Depression, and the programs that he has for high school students and children. It's a place I love to refer to. And there are, definitely lots of resources in the sense of mental health. Some are available via video. Some are, in person, depending on the patient's need or preference.
And I'll just add, I think there's a number of resources available. I'd say the most helpful resource is the people around you. So I would encourage all of you to think about who are the people in your environment, in your lives, who can provide support. Who do you trust in your family? Who do you trust at school? I'm always encouraged when I'm working with local schools, the focus, particularly recently, on wellness and just, helping kids with both, emotional and mental and physical health. So, there's people around who are eager to help, and keep that in mind. There are also plenty of resources. Paul alluded to this before, but there's a growing number of resources available, particularly for kids, to engage really meaningful and helpful ways to address the climate crisis. And what we know is that action can kind of really help us in terms of like feeling better about ourselves and our situations. And there are also, there are direct services to help with mental health. Dr. Iannotti alluded to services we have in Tarrytown. There's traditional therapy and helps, services that we can provide. There's also a lot online, right? You can Google videos and find a million different things on TikTok and on YouTube, and it's hard to know what's legitimate and what's actually helpful. I will tell you there are a couple organizations that provide really useful resources. The National Institute of Mental Health has great videos and infographics that just really neatly outlines, warning signs and helpful resources for mental health. And effectivechildtherapy.org is another wonderful website that just really lays out in clear terms, what are ways to know about different mental health concerns and what are supports that can help with those. And that's to supplement everything that was already discussed within the county, because the Department of Community Mental Health is a terrific resource that we partner with very regularly, and that has many, many valuable resources for youth and families.
Yeah, one of the things I could really emphasize is making sure that there is a communion with nature. Everyone has to be connected with nature. And as again, we are very lucky to be here in Westchester County because we have so many resources for people to get involved, whether if it's the Paddling and Rowing Club in Yonkers or the Compost Education Center in Valhalla. There's such a robust network of way people could get involved. And actually, during the summer when the Beeline bus was free, that was a really great opportunity where you could really jump on an electrified Beeline and really take the tour about our various nature settings in other areas of Westchester County. But I really would emphasize, spreading the word among young people on how they could get involved. They could, be able to, take tours and take advantage of the resource that we have here in Westchester County that other communities do not have access to, and really make sure that that is streamlined. And actually, things are so progressive here in Westchester. Like we're having conversations with young people about youth representation on environmental advisory committees. So it's really up to us here in Westchester really to really set the standard for what other communities could be doing, and that really will be led through leadership from example.
I think that was very well said. Now I'll hand it over to Ashley.
Thank you for your answers. Dr. Polifico, I'm so excited to learn about the work that you've been doing in the mental health space. I've been raising awareness regarding co-occurring disorders amongst youth through my volunteerism and my science research with the nonprofit organization, the Harris Project. Can you share some signs of a mental health disorder, such as anxiety or depression, and how a young person may know if they're actually developing a co-occurring disorder?
Dr. P, you're muted.
Thank you so much for that question, Ashley. It's really exciting to hear about the work that you're doing, and particularly for the Harris Project, which is such a helpful, useful organization for those who aren't aware, is really bringing awareness and providing resources for individuals dealing with co-occurring disorders, and particularly where folks are experiencing mental health and substance use concerns. So thank you for bringing light to that. In terms of your question, what are signs to keep an eye out for, to see if our mental health is struggling or that we might be dealing with mental health problems? I think there's a few that are important to keep in mind. One is withdrawing or avoiding. A lot of times when we're feeling depressed, we withdraw. When we're feeling anxious, we avoid. Those are our instinctual reactions when we're feeling those ways. And so if you find yourself pulling back from friends or family or activities or schoolwork, that could be a sign to say, hey, let me check in with myself. And, am I feeling overstressed? Am I doing too much? Dr. Ayanati pointed out sleep before. Sleep and eating are so tied to our mental health. And so if you're noticing that your sleep is very off or that your eating is very off, that can also be a sign that, maybe I'm carrying too much stress, or my mood is off, or I should talk to someone. And then irritability is another one. If you notice that you're more grouchy than usual, if you're crankier, a lot of times when we're feeling more depressed or down, it comes out as irritability. And so that could be another sign to check in with ourselves, or maybe check in with a trusted person to seek out help. Now, given this theme of, environmental health, we keep an eye out for what are triggers in the environment, whether it is, real climate disasters, whether it's very natural things like changing of the seasons. As the days are getting shorter, for some of us, that leads us to just kind of feel a little more down. And so, certainly with some of the things we're talking about today. So just keep these main things in mind, withdrawing, sleep and eating, and irritability is kind of some benchmarks and signs that we can keep an eye out for.
All right, thank you for that great response. Really going off of what Ashley said, if a teen believes and they see these signs within a friend and they think that they're struggling with anxiety or depression, what advice would you recommend a teen should give their friend, or what should they try to do to help that friend?
These are terrific questions. And I think this is a situation that many young people find themselves in. Many adults do, for that matter. How to help somebody we care about who we think is struggling with depression or anxiety or a mental health concern. The first thing I'd recommend is listen. Just be an open ear, be available, without judgment, listen to what's going on, be available for that friend. The second thing I would recommend, particularly for young people watching and listening, is to, talk to a trusted adult. For two reasons. Number one, it's real important if a friend of yours is struggling, that an adult is aware and can help out and can provide support. And secondly, because you as a young person shouldn't have to carry that alone. It's a lot to carry, and it's important for, to have an adult or adults to support you and your friend in terms of how to get the best help and how to be as healthy as possible.
Thank you so much for that answer. And I guess in a more general perspective, what are some ways that the youth can get involved in supporting environmental health, whether that be through initiatives, joining organizations, and things of the such? And this is for all of the panelists.
I would first encourage to continue having forums like this, making sure that you're able to streamline resources through the lens of digital equity, so no one has to travel too much. Just click on a link and you'll be able to access a video. And also connected to other organizations that exist. It could be Black Millennials for Flint, where you could see what they're doing to address water quality issues. Or obviously, I got to plug in the United Nations Association, because our membership is free for anyone up until the age of 25. And we have a robust civic engagement committee that's led by Mr. Johanna Edwards, who is doing amazing work, making sure that we get the word out to the community, especially with members being able to join the United Nations Environmental Program Major Working Group on Children and Youth. So you could be able to have these global conversations with people and really empower each other to be aware about what they can do and how they could be able to have that resilience mentally when you're exposed yourself to a whole spectrum of things that are happening throughout the world. But really making sure that connections are being made, and also those connections are being made through secure channels where you could be able to close a loop on a way of how you could be involved in being part of the solution. And all of you on the Youth Empowerment Council for Change are part of the solution. You're leading really, I don't know how many other communities are having forums like this in environmental health. So I really hope that you're proud of yourselves and continue to have forums like this to be able to connect your colleagues and your peers to the resources that are available to them.
I echo all of that. And I would only say that, what we know from a mental health perspective, and I said this earlier, is that getting engaged and collective action is one way we know to kind of build hope and to face struggles. And the climate crisis is certainly a struggle we're all dealing with. And we all have to kind of figure out how do we take care of ourselves. Getting involved and kind of working with others to take action is a great way to do that. There are plenty of options in Westchester. Paul's mentioned some of those. I know, the Sunrise Movement has a Westchester chapter that it's all youth driven, and that's just one other kind of option. And there are many other growing organizations. So find the one that works for you, and also find the way that works for you to be involved. For some people, that's, going to events and organizing and being loud. And for others, that's, working behind the scenes or finding, how do your strengths play out? How can you use your strengths and what works for you as a person to kind of be involved in the things that matter to you?
You guys have said it all so well. I think that I totally agree, and would just to close the loop on sort of the physical part of being involved, being active and being out, and the mind body connection is everything that we are talking about here, right? So taking an active role, and what we gain from participating, we give and you in return receive in many ways, in all ways in our lives. So
Well, I am jumping in because I see that we are approaching the end of this session. We did have a number of additional questions. However, we promised that we would keep this to a 1 hour session. And so I'd like to thank everyone for participating today. This gives me hope that there could be a part 2 in sight, because I know that there are so many more questions that our youth want to ask. And I'm sure once this video airs, we will get additional questions. I wanted to also just note and congratulate all of the members of the YECC for their work preliminarily. They did meet with our county executive and our deputy county executive on these very dear topics. They have listed a number of priorities for youth within Westchester County, physical, mental, and environmental health being of the most salient. So we thank you, Columbia Doctors, and we thank you, Paul, the UNA, for lending your time tonight to address some of the issues that our young people have identified as being most important to them and their peers. Once their report is complete, and I suspect that they're taking notes, at least I hope that they're taking notes, so that they can go back and refine their report and their recommendations to the county executive, who has pledged his full support, so that we can increase access to address the many issues that we discussed today. I think that you all gave some brilliant responses, and I want to thank the young people for also coming up with these questions, because based on this conversation, I see natural enthusiasm. And again, I'm just so very proud of all that they have accomplished and what they will accomplish. And you may have noticed that I was smiling exceedingly when Paul spoke, because it was not too long ago that he was in the shoes of the young people that are asking the questions tonight. So I hope that this serves as additional motivation to you all, the YACC, because Paul, you spoke so eloquently. And as a recent graduate, and just to know all that you've been able to accomplish, and you speak eloquently as if you've been at this work for many, many years. I want to applaud you for stepping in the 11th hour, meaning yesterday, to agree to do this. So I had to note that Paul did not have lead time. He actually did this as a favor and based on his passion to help our climate, our community, and to be amongst the physicians that are here tonight. I want to say thank you to you, Paul, for jumping in the last minute like you did. I also want to again express our appreciation for Columbia Doctors. This is our first partnership, and I hope that is the first of many, particularly as the YACC continues to refine their research, but also as we start to plan for our MedTech conference next year. We're very excited, and many of them may not even realize that they'll probably be spearheading some of the workshops. And so we hope that we can see you there and partner with you prospectively in the spring. So I'm going to turn it over to our youth board deputy president, who is Isabella, who's done a fine job, along with I'd like to thank the leadership, Julianne, Josh, Ashley, Arun, as well as Naveen, and of course Sarah, for joining us tonight. I know that we will have a number of young people tuning in once this video is released. So again, thank you, and I'm going to allow Bella to close us out.
Thank you, Dr. Harris Madden. On behalf of the Westchester County Youth Bureau and the YCC, thank you all very much to our panelists and our YCC members who are able to participate in this discussion. Thank you to those watching, and we all learned a lot, and this was a valuable experience, I think, for all of us. So thanks again.